September 30th, 2014. I had an email question about the report coming out of Dallas, and what they're saying is that North Texas Hospital has a patient in isolation as they evaluate them for potential exposure to the Ebola virus. Officials with the Texas Health Presbyterian Hospital in Dallas released the following statement last night. It says, Texas Health Presbyterian Hospital Dallas has admitted a patient into strict isolation to be evaluated for the potential Ebola virus disease, what they're calling EVD, based on the patient's symptoms and recent travel history. The hospital is following all Centers for Disease Control and Texas Department of Health recommendations to ensure the safety of patients, hospital staff, volunteers, physicians, and visitors. The CDC anticipates preliminary results tomorrow. Now, that would be Wednesday morning. Today is Tuesday. The report came out last night. They're saying the symptoms remain unclear, but it's said to involve a high fever and vomiting. They have not released the name of the patient. Now, they're saying the travel history remains unclear, but they're saying that Dallas County Health and Human Services Director Zachary Thompson, who confirmed that the patient had been in an area where the Ebola virus exists. Looking at the travel history is the first indicator, and then the next step is treatment or non-treatment once we get lab results. Thompson definitely felt that there should be a heightened sense of awareness in North Texas based on what has happened internationally. With what we've seen in the media and how deadly the Ebola virus is, it is a concern, he said. You guys in Dallas, Fort Worth, pay attention. Thompson stressed that there are certain procedures that will be followed if tests for the patients come back positive. He said, we, the health professionals, all have been planning to look at what our next steps are if there is a confirmed case. Again, we have to do the public health follow-up to see what contacts, where the individual has gone since they arrived in Dallas, and there are a number of things that have to be looked at. And of course, any of you people that you may want to choose another hospital for the next few days, just in case. As far as possible infection to others here in North Texas, Thompson said the key point is if there has been no transmission, blood, secretion, any type of bodily fluids by the infected person to someone else, then that risk is low to none, and that would be important. Now, the CDC is saying that the Ebola virus has killed more than 3,000 people across West Africa and infected several Americans who have traveled to the region, including Fort Worth Dr. Kent Brandley, who contracted the disease while doing missionary work in Liberia. 4 infected patients have returned to the U.S. in specially outfitted planes. 3 were tested in Atlanta and the 4th in Omaha. An American physician who was exposed to the virus but not infected was flown to Maryland over the weekend. So it's a creep procedure, but as slack as some of the measures that they have taken are that we've seen when the first doctor came into Atlanta. Remember, he got out and walked in to the hospital if he was infected at all. It seems to be a big pharma control game in a lot of ways. There's a lot of money involved in big pharma. A lot of money. But guys, this is a heads up for you folks in Texas, the people that have traveled in and out of the airports. And Dallas is a major hub. I've stopped there and going to Los Angeles and into that area. It's a major hub. So that would be a perfect environment for the spread of this. We don't know that, like I said, they're not releasing much information on the exact travel time, arrival time, things like that. But if you have traveled and you've been in Dallas Airport, the Dallas-Fort Worth area, you need to call them because you have the right to this information. The general public may not, but you do. It's a heads up. Be safe.